all very aware, gun violence is a serious and uniquely American problem. Our Speaker Series Board had many thoughtful conversations about how to present this issue to you in a solutions-oriented approach that would not be politicizing or polarizing. And as a board, we want to make it very clear to our audience, we are not against responsible gun ownership. And tonight, we are not going to deal with the merits or the non-merits of the Second Amendment. So what we are going to do is follow the recommendation of the U.S. Surgeon General, who stated, if we can see gun violence as a public health crisis, like we did drunk driving, like we did cigarette smoking, then we can come together to implement public health solutions. And to that end, we are pleased to have the Chief Medical Executive for the state of Michigan, Dr. Natasha Bagdasarian, or Dr. B, as she likes to be called, who will describe a public health approach to decreasing and preventing injuries and deaths in Michigan. Dr. B has a lengthy and impressive resume, and she told me, don't talk about it. So I said, okay. I will say, however, her expert testimony before the Michigan House of Representatives was instrumental in passing a package of bills for the prevention of gun violence. And those went into effect this past February 2024. Now, please join me in welcoming Dr. Bagdasarian, who will speak on a public health approach to gun violence prevention.
And you know, this is a deep topic that we're talking about today. This is a dark topic. And the reason why I think it's important for people like me to talk about this is because this is a health issue. If it's killing our kids, it's a health issue. And so that's why I'm really glad that we're having this conversation today. And part of this conversation is really understanding the issue and looking at it the way we look at any other public health issue and understanding who it's impacting and how and what the circumstances look like before we can focus on what the solutions are. And just on a personal note, this is a topic that's a little bit outside of my normal wheelhouse. So I am not a pediatrician. I'm not a psychiatrist. I'm an infectious disease doctor. And my typical wheelhouse are things like influenza and RSV. So this is a little bit outside of my wheelhouse. But the reason why I think this impacts people like me and people like you all is because this is something that we're hearing about on the news all the time. And for me, after I did all of my training here in Michigan, I moved overseas for a few years. I practiced medicine in Singapore for about almost 6 years. And one of the things that really struck me when I moved overseas is the only things I heard on the news about America were shootings. That was all I heard about America when I lived overseas. And when I would travel in Asia, we'd go to Thailand and all kinds of exciting places on the weekend. I would talk to taxi drivers and people who were in the tourist resorts. And the only thing they would ask me is, what's up with you guys? And it really started to hit home in a way that was very different than when I lived here. I think I tuned it out. I tuned out all the noise. And when I lived overseas, it felt somehow more personal. And I moved back to Michigan in 2020. I don't know if you guys remember, there was a little pandemic going on. It was actually kind of an exciting time to be an infectious diseases doctor. But I moved back here in 2020, and one of the things that I first thought about when we made the decision to move back is I had a 6-year-old, and he was going to be going to school in the United States for the first time. And it was the first time I ever had to think about shootings in schools. And everyone around me in that expat community said, well, gosh, Are you worried? And so it's been on my mind since I moved back. And, I think all of us think about this type of violence and these types of stories because they're becoming more prevalent. But let's dig into the data. So this talk is about science and data and facts, and we're going to follow the data just like we follow the data on things like cancer deaths, and try to understand and make sense what's going on. So we're going to start with some trends. But what I want you to really look at here is that firearm deaths are increasing. And we've got Michigan in orange and the United States in blue. But this is something that was building, but you can really see 2019 is when those rates just shot up. So 2019, the pandemic, things really got worse, both in Michigan and around the country. And here, we're a little bit worse than the national average when we talk about firearm deaths. In 2015, firearm deaths surpassed motor vehicle accidents as a cause of death for the first time in a generation. So again, really sort of startling statistics, and again, you're looking at these trends and saying something happened in recent years. Now, one of the things that I think is surprising is when we look at firearm deaths overall, I tended to think of this as a problem for young people. Young people are dying of firearm deaths, but it's not just young people. We almost have this bimodal age distribution, where definitely we have young people dying of firearm deaths, but we also have older people dying of firearm deaths, and we're going to dig a little bit deeper into that. But this is the graph that gives me the most heartache, and this is why we're here today, is because firearm deaths are now the #1 cause of deaths for children in the United States and children in Michigan. And you can see this orange line here, those are the firearm-related injuries. So in 2020, that was really the first time in Michigan those numbers were higher than motor vehicle accidents. You can see a lot of things have remained stable across years. And blue are those motor vehicle accident rates. And we've made progress there. We're going to look at this chart again and dig a little deeper into this. But firearm deaths are now a bigger killer of children than cancers and drownings and all kinds of things that we treat as public health issues. So this is Michigan data. Again, we're looking at who is impacted by firearm deaths or gun violence, however you want to refer to it. So typically, and this is not unsurprising, it's typically males. Males outnumber women disproportionately. When we break it down by age group, you can see that top age group, the orange line, are those between the ages of 25 to 34. So we're losing young people. The next line, the blue line, are those 15 to 24. And then under 15-year-olds are here at the bottom. But it's an important factor to consider because #1, we're losing young people, and we're losing young people who otherwise would not die. These are not young people with heart disease and other age-related complications. We're losing healthy young people. And that's why it's the #1 cause of death in those under the age of 19. When we look at mortality by race, it's something that disproportionately impacts Black Michiganders compared to white Michiganders. And when we look at the geography of our state, this also may surprise you. It impacts different parts of the state at different rates, but this is not just a Southeast Michigan problem. So you can see that Wayne County, Detroit, yes, but some of the areas that are the darkest color are in the UP. So this is a problem that impacts urban communities and rural communities. And we have to really look at this issue as 3 parallel processes that are impacting different parts of the community in different ways. Just like when we look at cancers, we don't just say all cancer. We know that there are different types of cancers that impact different age demographics and different groups of people differently. So I separated out by self-harm, harm to others, and unintentional harm. And we'll go through each one of these. But I want to just talk about why they look a little bit different. And first of all, one of the things that when I first entered this area, when I started looking at the statistics, I was surprised by is that firearm-related suicides are over half of deaths in both Michigan and the United States. So we've got, both from Michigan and the US, suicides are about 56%. Homicides are in the 40%, and then we've got a very small proportion that are unintentional deaths. So we'll talk a little bit more about those different types of firearm injury. When we look at that distribution, remember we had talked about the fact that different parts of the state have different sort of issues going on. And part of that is because of the differences that we're seeing between homicide and suicide. When we look at firearm-associated suicide, that's when it's mostly rural counties. And when we look at firearm-related homicide, that's when it's mostly urban counties. And you'll see that there are a lot of counties that are grayed out, and that's just because numbers are too small to accurately reflect. So we have to think of these as different problems with different solutions. And I showed you that bimodal distribution, that this is a problem. When we look at firearm-related injury overall, it's a problem that impacts young people and old people. But if we separate it by suicide versus homicide, what we're seeing is that homicide happens to the young, and suicide is something that actually peaks at much older age groups. So again, who it's impacting, it's different interventions, it's different implications. We have to think about these as slightly different problems. So let's talk about who suicide impacts, who has the greatest harm from suicide. And so when we look at the breakdown, when we look at the demographics of that 56% that are firearm deaths from suicide, it's mostly white men, and they're mostly over the age of 55. And we already talked about the fact that these tend to be more rural counties. And the odds of suicide are much greater if you own a gun, if you have a gun that's unsecured. And we also know that 90% of suicides are fatal. So when we talk about firearm injury that is non-fatal, it's not really the suicides we're talking about, because firearm-related suicide attempts are almost always fatal. So let's talk about this harm to other piece. In general first, and then some of these special circumstances, things like domestic violence and mass shootings. So when we talk about firearm homicides, it's a very different population that's being impacted. It's predominantly black men and young black men. So you can see the peak here is 25 to 34, but also a second peak in the 15 to 24 and 35 to 44. So it's young black men who are impacted. Now, when we talk about those special populations, those other specific circumstances, it's different when we're talking about domestic violence, for example. So interpersonal violence, it is almost always something that is a male partner who is shooting a female partner. And it's disproportionately impacting American Indian, Black communities, and Latinx communities. So it's young women of color who are impacted by interpersonal violence. And in fact, does everyone here know what the #1 cause of death is during pregnancy in the United States? It's homicide. The #1 cause of pregnancy, the #1 cause of death during pregnancy is homicide. And these are the people who are impacted disproportionately. So if we're talking about firearm injury and gun violence, we have to talk about mass shootings because this is something that's on the news all the time. I talked about the fact that when I was moving back to the United States, I thought a lot about this. This is what I was scared of. But these active shooter incidents, they are a very small percentage of actual firearm deaths. They get a lot of attention, but it's a very small total percentage, less than 2% overall. However, they're increasing. And this is a graph that shows casualties in blue and incidents in gray. And again, you can see that something started happening post 2017, 2016, those numbers started going up. So even though it's a very small percentage of lives lost overall, it's very impactful. I think it's impactful to our psyche. I think there is some trauma that we all have when we see these stories on the news or when we hear people's accounts of being involved in something like that. Or as I was talking to some of the audience members about the kids who have to go through active shooter drills at school. And school shootings, this I found just shocking. Again, it's a very small percentage, but look at how those numbers have increased post 2016, 2017. And this is increase in the number of incidents, in the number of victims, and in the number of deaths. Let's move now to unintentional harm. I'm sorry, this is a really dark topic. We will talk about some solutions at the end of this. I know it's hard to sit through some of these statistics. It's hard for me even to talk about. Let's talk about unintentional harm. Unintentional shootings, I sometimes find to be the most tragic. Again, this is a very small percentage of lives lost. So we're talking about 1% of the overall lives lost to firearm injuries. I find this tragic because these are so preventable. No one's actually trying to do harm in these cases. This graph I found really hard to look at when I first put it up here because you can see unintentional shootings, it's something that happens most often in kids. But when we look at both the shooter and the victim, the peaks are toddlers and high school kids. And, you know, we're really talking about two victims here because the person who is holding the gun is also a victim and will also be haunted by that trauma, as well as the person who receives that bullet. So two peaks, high school and toddlers to pre-K. Shooting by toddlers and pre-K students have increased while shootings among high schoolers have decreased. But you can see overall these have tended to be pretty stable. But to me, this is the lowest hanging fruit. These are the most preventable. And I tried to make sure that I remove the word accidental shootings from my slides. I may have missed a few times and use unintentional because one of the thoughts is that these are completely preventable, so we shouldn't call them accidents. Accidents are sometimes not preventable. These are preventable. So they're unintentional, but very preventable. And when children unintentionally shoot someone else, the victim is most often a sibling or a friend. So again, think about that trauma. It's not just a trauma to the person who is shot. It's a trauma to the person who has unintentionally hurt their sibling or friend. This was a study that came out in the MMWR, and it looked at 1,200 unintentional shootings and the circumstances around those shootings. And again, lowest hanging fruit. So let's dig into what are the circumstances, because then we can figure out ways to prevent them. And most of the time, so for all of these age groups, from the littlest to the teenagers, the circumstances were most often they were playing with a firearm or showing a firearm to a friend. They unintentionally pulled the trigger. Again, that's pretty prevalent across the board. But here we've got a difference between the youngest and the teens. So the littlest ones, those 10 and under, they thought that the firearm was a toy. And the teens most often thought that the firearm was unloaded. So again, we've got some opportunities to prevent these. Where were the firearms stored? The most common locations were inside a nightstand, under a mattress, under a pillow, on the top shelf of a closet, not places that I would consider safe storage. And across the board, the vast, vast majority of these circumstances, in all age groups, the firearm was loaded and unlocked. Again, so preventable. So preventable. And so if we think about the lowest hanging fruit, because we need to talk about this as a health issue and something we can really intervene on. No one wants their 2-year-old playing with a loaded gun. No one wants their 5-year-old shooting their sibling. No one wants their 16-year-old shooting their friend. So these are preventable, and I don't think there's anyone, whether you're a gun owner or not a gun owner, I don't think there's anyone who would agree that those circumstances are okay. So to me, this is a no-brainer. So what is a public health approach? And we'll go back to that slide that I showed you at the beginning. And when I look at this slide, I am struck by the rise in firearm-related injuries. But the other thing that really strikes me is, well, look at the blue line. Look at the motor vehicle accidents. How do we get that line down? And how do we replicate that? How do we do the same thing? How do we turn firearm injury into motor vehicle deaths? Which, by the way, do you all remember those ads on TV in the 80s about buckle up? And do you remember when people were interviewed about seatbelt laws? They were livid. How dare you tell us to wear seatbelts? And now we all just sort of do it. It's not even a big deal. So how did we get our motor vehicle accident rates in terms of killing children? How did we get those rates down? So I started digging into this. This is a little bit before my time, but the first thing I learned is that it was not a single law. It was not a let's ban cars. It was not a everyone has to drive 10 miles an hour. It was a series of gradual steps. So it started with speed limits. So Michigan got their first statewide speed limit in 1956, and that was 70 miles an hour. In 1960, there was the first drunk driving law. Again, people were not happy about this stuff. In 1968, there was a federal law that required all new cars to have seatbelts. And then it sort of gets a little bit more interesting. In the 1970s, airbags were introduced. And then this really surprised me. I got stuck on this. In 1983, car companies pushed for seatbelt laws. And I was reading about General Motors going around and talking to state legislators about seatbelt laws. Does anyone know why? Does anyone remember that, or you don't know why? So I dug into this a little bit. And in 1983, the Secretary of Transportation was Elizabeth Dole. And she put in place a federal requirement that all cars needed to have airbags. And the car companies were livid because airbags were really expensive. So she put a little escape clause in this. And if 2/3 of states had state seatbelt laws, then the car companies didn't have to put airbags in all their vehicles. So guess what the big three did? They lobbied every single state to get a seatbelt law. And so we ended up with a seatbelt law in 1985. What a coincidence. And then there were all kinds of other things that happened. There were media and informational campaigns, and look where we are. Motor vehicle accident deaths for kids are at an all-time low. So when I talk about a public health approach, I'm talking about things like this. How were we successful then? People weren't happy. It required gradual, incremental approach. It also required people to work together in really interesting and creative ways. So for seatbelt laws, if our biggest champions in getting state seatbelt laws were the big three, who could we work with now? Maybe gun manufacturers. My list of slides for problems were much longer than my list of slides for solutions, because the solutions are still coming. But I'll tell you that we've got some great resources out there. So the Michigan Department of Health and Human Services has been tasked with educating the public on safe storage. And so we're doing a lot of work right now to tell people what safe storage is. It's not under your mattress or under your pillow or the top shelf of your closet. It means making sure that your gun is locked somewhere, that you have a cable gun lock, or that it's in a gun safe and it's unloaded. So we're doing a lot of media efforts and educational efforts around that. We're handing out thousands of gun locks around the state for free. But what I've heard is people who come to events where they're getting gun locks for free, without the education, without really believing that they need to go home and secure their guns, do you know what they use those gun locks for? They're really great bike locks, too. So we want to give out gun locks, but we want people to use them for their guns and not on their bikes. And the other move in the right direction is the governor has established a gun violence prevention task force, which I am proud to be chairing. We have new gun legislation that was passed this year. The big ones are red flag laws. So if someone is a danger to themselves or others, if you believe that someone is actively suicidal, for example, they can have their gun removed for a short period of time until they are no longer a threat to themselves or others, universal background checks, and then safe storage. And what we are hoping for with the Gun Violence Prevention Task Force is to really focus on two things. Number one, we've got this gun legislation. It's a start. And we know that states that have strong gun legislation have lower rates of firearm injury and death. And one of our arms of this task force is going to be, how do we implement this new legislation? How do we make sure that everyone, for example, knows what safe storage is? How does everyone not only know what it is, but feel passionate about it and have access to a gun lock? And then the other arm is, what new policies are going to be helpful to solve those three problems that I outlined: harm to self, harm to others, and unintentional harm. And I think because we've looked at the data and we see that these are different problems, they impact different communities in different ways in different parts of the state, we'll be able to tailor policies and interventions that specifically address the issues underlying each one of those. So that's all I have for my prepared slides, but I'm happy to take questions and have a discussion with you all. So I haven't had any conversations with gun manufacturers yet. I think that we have a lot of groundwork to do until we get to that point. I think that making sure that we have engagement from gun owners is really important. I think there's a lot of people out there who don't want to hear from me. I don't own a gun, and so I'm not the right person to deliver that message. I can talk about this as a physician. I can talk about this from the perspective of patients I've taken care of. When, for example, I take care of a 25-year-old paraplegic because of a spinal cord injury that he received from a gunshot wound, I can tell those stories, but I think stories will only go so far. And when people want to hear about safe storage, for example, they may want to hear from other gun owners what that means. And so we have to engage people from different walks of life, from different communities, from different parts of the state. And I may not be the best person to talk to the gun manufacturers. It may be the gun owners talking to the gun manufacturers.
What are the statistics in states that have implemented more significant gun legislation compared to states that have not, as far as the statistics that you see?
So the breakdown that you saw tonight, that's a breakdown that I did specifically with Michigan data. So I don't have a breakdown like that. I did have a slide. I've got a whole hidden set of slides that I didn't show you all tonight that shows gun injury and death rates in states with tighter laws versus those with more lax laws. And there is a clear difference. So states that have tighter laws tend to have lower rates of gun injury and death. But we have to also recognize that it's not only the policies, there are also different levels, rates of gun ownership, of accessibility, of sort of culture and accessibility when it comes to guns. So there are lots of things at play, but there is a very clear association with tighter policies and restrictions and lower rates of gun death and injury.
I'm getting a lot of mail from candidates lately, and none of the candidates, whether they're a Republican or a Democrat, mention gun safety or gun violence on their literature. So how can this problem be solved if they don't have the courage to put it on their mail?
I'm not an elected official, and to be honest, I work in a very political world, but I didn't know a whole lot about politics until like 2 years ago. But what I've really seen is the power of grassroots action. And, I was at the bill signing when the governor signed that package of gun legislation, and the people who were there were Moms Demand Action and Every Town, and there is a lot of power in that grassroots activism. And so if you care about a topic, vote for the candidate who you think is going to reflect your views, but also please engage in some of that grassroots activism because it works. We've seen it work.
Could you give me a couple examples of gun safety storage?
I can tell you about the locks that we hand out. They are cable locks, and so they go. You're going to really hear how little I know about handguns when I try to describe the pieces. So it looks like a bike lock, but it goes through the barrel of the gun and sort of loops around so that nothing can be discharged through the barrel of that gun. So the recommendation is to store your gun unloaded and locked in some way, so either in a gun safe or using a lock like this.
From End Gun Violence Michigan, we work with Dr. B on a few things, and I wanted to answer a couple, or at least respond. Florida actually passed safe storage for kids, and they saw about 50% reduction in youth death. So we were actually able to track that and talk to Florida about that gun law when we were trying to get that done in Michigan. That was one point. And the other point was University of Michigan Firearm Institute is actually working with gun manufacturers, because what you hear from gun owners is, I need to get to my gun quickly. That's kind of everybody says that. And so they are actually working on with gun manufacturers about like a thumbprint or something like you do with your phone and other kind of technology. So it may not have quite caught up, but it looks like there's work being done in that effort. And the other point was End Gun Violence Michigan has also worked with Moms Demand Action, Gifford's Gun Owners for Gun Safety, and so it's a broad coalition that's actually doing the grassroots work.
Thank you. I think those are really good statistics to bring up.
What are we doing with sheriffs that won't enforce red flag laws? A lot of them stated that they weren't going to enforce them when they were passed. So I don't know how do we, because a law is no good if it doesn't get enforced.
Yeah, I think that is an excellent question. Again, I am just a doctor. So that's a really great question for the Attorney General's office. But, you know, I think that we also have to realize that there's policies and laws, but there's the educational component as well. And so my role is to make sure that that educational component is pushed forward as much as we can. So one of the things that I'm doing specifically in safe storage is we've got a coalition now of, I think I have every single health system represented in the state. And I want to make asking about safe storage as routine as, do you smoke? So when you go to your doctor's office, do you smoke? Do you have a gun in your home? Is it safely stored? Because it's a health issue. And so, yes, there may be sheriffs that don't enforce these laws, and I don't have a good answer for you, but maybe Dana Nessel does. And I am going to push that educational component as much as I can, because I think it's a health issue, and we've got to start talking about it as a health issue.
I'm thrilled to know that you're chairing a group that's going to look into this thing, because I think back of commissions that have done this. My hope is, and my question is, are you able to reach out across the whole country and look and find the, you know, we don't have the answers to this. You don't have the, I don't have the answer to it. But find experts that deal with children every day, that deal with mental health every day, and say, come together like they did in commissions before, come together and help us develop some answers that we can then start implementing like you've done in the auto industry. So I'm hoping that you can reach out far across the country in what you're doing, and I'm thrilled that you're chair of this.
Well, thank you for your vote of confidence. Number one, I run a tight ship, and I'm going to make sure that everyone on this task force is focused on solutions, because I think we could just sit and talk about the problem all day, but we've got to be forward thinking and focus on what are the solutions in a very non-political, apolitical way. We've got some things on our side. Number one, we've got people from across state government who are joining us. So we've got the Michigan State Police, and we've got sheriffs, and we've got doctors, and we've got the health departments, and we've got the Department of Education. So it's a really broad group of people. And then we're going to bring in anyone who has a thoughtful, helpful approach or perspective. So we're going to bring in lots of other people from different communities. And then we're also working with partners like the University of Michigan gun violence prevention program to do our data analysis and policy analysis. So I'm really hopeful. And that's why I put it in the solutions part. I don't have concrete solutions yet, other than let's start talking about this, but we will have concrete solutions when this task force is complete in a year.
How much, being a doctor, how much difference did it make making cigarette smoking and alcohol consumption a public health approach? Did it lower all of those? Are there less people having cancer? Is there less people drinking alcohol? I mean, we just come here and we had free alcohol. It was wonderful.
yes, those interventions work. Those interventions have worked. So, for example, when you put restrictions on who can buy a pack of cigarettes, there are fewer kids buying cigarettes. So, yes, those policies work. But what we have seen, I'm just going to talk about the tobacco thing for a quick second, is, the manufacturers have a highly addictive product and they want to sell more of their product. And so what we've seen is this sort of arms race that we put things in place to keep people safe, rules about advertising and who you can target and can you use a cartoon to sell cigarettes, and then they come up with candy apple flavored vape. And so it's a struggle, and our work is never done, because for every step we take forward, they're 2 steps ahead of us, and they've got much deeper pockets than public health does. So making sure that we've got strong public health, well-funded public health that is working for the people is really important.
I have a question. How can a citizen become involved in helping to prevent the gun violence? How can we as individuals help?
That is a really great question. I've got 3 pieces of advice. And again, this is I'm just a doctor. I don't really know how these things work. But number 1, vote. Vote for whatever you believe passionately in. Number 2, get involved in these grassroots organizations. So I mentioned the names of a few, but find an organization that represents your views and join them, because they are doing really good work. But number 3, what we found in public health in the last few years is that, again, folks don't necessarily want to hear from me. People who don't know me, they don't want to hear from me, my views about gun violence or smoking or vaccines or whatever, but they might want to hear from you. So I think that if you are someone who has a strong conviction, talk to your family and friends, because you are in their trusted network, and some of these conversations are not easy. Get on social media and put some stuff up there. Join your grassroots organizations and take their social media posts and repost them, so that something that was once considered taboo and you can't talk about these topics, we're just talking about them. And they're coming from a trusted messenger within that community, and that's you. So talk about these issues, and it's not easy. My example is, I am an infectious disease doctor, and I really strongly believe in things like vaccines and things that have science and data behind them. And I was recently on a family trip, and one of my husband's cousins really proudly told me that she was an anti-vaxxer, and she has 3 little kids under 3, and 2 of them were like babies, and she's not getting them vaccinated, and the 3rd one has a congenital heart defect and was going in for corrective surgery, and if he gets a pulmonary infection, he is in big trouble. And much to my husband's dismay, I talked to her about vaccines, and he just sort of sat there like, leave it alone. But I think it's important to have these conversations with our social networks, with the people who trust us, because I can't reach everyone, and not everyone wants to hear from me, but they do want to hear from you.
I'm a member of a gun club. I want people to come in and join the club who have never touched a gun, who know nothing about it, and learn how to get your concealed weapons permit, learn how to use a handgun. Okay, now I realize that this is, I'm in support of what your goals are, but if regular people came in and learned and joined the club and learned how to use a handgun and understand how weapons work, you may have a better chance of influencing people. Because the first thing that comes out of their mouth is, you don't know what you're talking about. It looks like a big ugly gun. That's all it is. These are the arguments that are used. Just coming from a person who is a member of a gun club, and I do support what you're presenting. But this is a way to get an inroad into the mindset of people who want to be able to carry a gun anywhere.
Thank you. If I could just respond and maybe push back a little bit. I'm a doctor, and so and I'm an epidemiologist, so what I know best is data. And so I am the best person to talk about data. I know I'm not the best person to talk to gun owners. You know who is? You. Because you belong to a shooting club. You are the best person to talk to gun owners. I know I'm not the best messenger for everyone. I am great at talking to other doctors. I am great at talking to people who love data as much as I do. Did you notice that all my slides were just graphs? There's no words on. I don't like words. I like graphs. I like data. So I'm the best person to talk about data. You are the best person to talk to gun owners. So please go out there and post some stuff on your social media tonight.
One more here. Okay. From the presentation, it's from a public health perspective, it's easy to look at suicide and unintentional harm and think of strategies and education and things you can do. But the elephant in the room was that middle category that you really didn't address, community violence. Is your group looking into that aspect of gun violence with the same kind of fervor you are on the other two categories?
Yes. In fact, we at DHHS have an Office of Community Violence Intervention. So we don't have an office of self-harm or suicide. We don't have an office of unintentional death. We have an Office of Community Violence Intervention. So I think that that's something that is definitely being paid attention to. The goal is to look at these things across the board. There is no goal to focus on only one. We've got to look at the whole picture, and that's part of the picture. And there are segments of community violence that look a little bit different. There is domestic violence, and I think that looks very different than mass shootings and school shootings. And so there's going to be a nuanced approach to how we intervene on each of these different things. So I would like to challenge each one of you to find a topic that you deeply, passionately care about and join a grassroots organization and get involved and make some waves and make things happen. It doesn't necessarily have to be this. Find something that moves you and try to move the needle. Thank you all.